There's a new approach that may help make daily life more predictable for those with Parkinson's disease.
This common movement disorder impacts nearly 1 million Americans, and now there's a wearable device that can help them. I recently talked with Dr. Stuart Isaacson, director of the Parkinson's Disease and Movement Disorder Center of Boca Raton, Florida, about this new treatment. I think a lot of us have heard of Parkinson's because there are a lot of high-profile people who've talked about it. Michael J. Fox, of course, Muhammad Ali, Kirk Gibson. But for those who don't know, can you just explain generally what exactly is Parkinson's and how does it work?
Well, Parkinson's disease is common. The second most common neurodegenerative disorder of aging. Over 1 million people in the U.S. have Parkinson's disease. We don't know what causes Parkinson's disease in most people. About 1 in 4 have a gene that can cause Parkinson's. We're working on a cure, but for now we focus on treating the symptoms of Parkinson's, the movement symptoms and the non-movement symptoms of Parkinson's, in trying to help people over the decades they have Parkinson's have as normal lives and carry out all their daily activities as best as they can.
Doctor, I think we're aware of the tremor in terms of symptoms of Parkinson's, but some of the other symptoms aren't as well known. Can you talk about some of those and how they affect someone's daily life?
Sure. Well, we now understand that Parkinson's disease begins probably 5 or 10 years before we make a diagnosis with non-motor symptoms. Things like loss of smell, constipation, low blood pressure, acting out of the dreams overnight. And then a shaking of the hand, a tremor might come out, and there's slowness and stiffness in movements. Walking may be slower. There may be reduced arm swing or pain in the shoulder. Balance may be affected. The voice might be lower. Handwriting might be smaller. These are all symptoms that occur in Parkinson's disease due to a loss of a brain chemical we call dopamine. And our strategies of evaluating and treating Parkinson's disease are twofold. One, we want to make an early and accurate diagnosis of Parkinson's disease. We rely on the clinical symptoms and the examination and some new information about how we can use gene testing, a new skin biopsy, and a brain imaging test to make an accurate early diagnosis. Then we want to begin treatment to increase brain chemical levels of dopamine by giving medications, often pills, that can become dopamine in the brain and improve these symptoms initially.
Well, you mentioned some medications, and the FDA recently approved a new treatment. It's just for people with advanced Parkinson's disease. Can you talk about that?
Yeah, well, it's interesting because initially we know dopamine levels are low in Parkinson's, and they get lower and lower as the years go by. And we give levodopa, and about 2 dozen other medicines we can use to help levodopa work better over the years. Many people are taking levodopa, but they find after a few years that instead of taking a dose of levodopa and they have benefit all day long, now they take a dose of levodopa and it may take a longer time to work, and it only lasts for a few hours, and then the symptoms return. Higher doses, more medications added on, they still have these ups and downs like a roller coaster, never knowing if the medication will be working, giving benefit, and they can go to work, go to their jobs, visit with family, go to dinner, exercise, or the medications are not working. And this unpredictability can really affect daily lives. So we've long sought a treatment that might be more even and not have these ups and downs. And that's what ANAPCO is, and why we're so grateful that it was recently approved by the FDA. ANAPCO has been available in Europe for over 30 years, so we have a lot of information about it, and we were able to study it here in the U.S. in people living with Parkinson's in the U.S., and we added ANAPCO just onto those medications, and we found improvement within a week. We found that ANAPCO was effective and safe. Could have side effects in some people with nausea or dizziness or sleepiness, skin reactions, but overall it demonstrated tolerability. But it's different than a pill because ANAPCO is not a pill. It's a wearable device. Someone with Parkinson's puts it on in the morning, and it gives medication just beneath the skin. Gets into the bloodstream, into the brain, where it works like dopamine to improve symptoms evenly throughout the waking day. People take it off before they go to bed and then put it back on the next morning. So ANAPCO can give this more continuous, consistent benefit throughout the waking day because it's not swallowed, it doesn't have these ups and downs, but is more even.
Well, it sounds like the goal is for this wearable device to make the daily life of somebody living with Parkinson's just a little bit more predictable. Where can people go for more information about this new option?
Well, I think it's important that they're aware of this new option. We have lots of new options, 3 new drugs this year. This NAPCO the latest. They should keep track of their symptoms, when medications are working or not working. If they have loved ones or family or friends, let them know about it. They should talk to their doctors and nurses. And more information is available online at a website called napco.com. ONAPGO, napco.com. A lot of information there about a NAPCO and also about Parkinson's and about tracking symptoms to know if this could be right for someone.
Dr. Isaacson, thank you so much.
Sure, it's good speaking with you.
The preceding portion of the Arizona Daily Mix was sponsored on behalf of Supernus by First Line Media.